So in today's class we will learn a little bit more about a disease called as cholera. I think most of you have heard about the disease. Today in this class we will learn about the how human beings came aware about this disease, little bit of the history and what is the present scenario in today's day. If we look at the history, the terminology cholera is presumed to be derived from Hippocrates, according to whom it could be from coal and rain, that is the bile to flow. However, other sources confirm that, like Alexander Tralinius, he described that the word has derived from choledes, that means evacuation of intestines. Similarly, later on, about the 1800s, Emil Litter described cholera like flowing of water from the gutters of the roof. Coming back to the Indian perspective, similar kind of illness was described even in Shrushruta Samhita, and the disease was called as Vishuchika. Coming to the local area, most of you would be familiar with the word Olaota. That is the word that is commonly described for the disease. Well, the Olaota means Ola, that is purging, either vomiting or defecation. Similarly, various other words have been used time to time throughout the human history, especially in the Indian subcontinent. The disease was occasionally mentioned in various literature, from Avicenna in even the Chinese literature. However, the breakthrough came in the year 1817. Why? Because in the year 1815, there was an explosion of a volcano called Mount Tambora in the Indonesia. The volcanic eruption was so severe that the aftermath year, that is 1816, almost had no coverage of the sun, also called as the year of no sun. Because of these drastic environmental changes, the year 1816 and the subsequent year 1817 saw huge amount of rainfall in the Indian subcontinent, leading to flooding, especially in the Gangetic Delta. This flooding later on showed a few patients who were diseased with a kind of a disease in which the patients were vomiting and defecating copious amounts of fluid, and many people started dying. This kind of a disease was later described as you can see in this picture. Patients became emaciated, dehydrated, and slowly some of the patients also died. This is the reason why cholera is also called as the blue death. People become dehydrated. Later on, when the sepsis stepped in, people become cyanotic. The disease was at the earliest recorded in the Jessore, now in Bangladesh. Later on, the disease spread rapidly to Calcutta or Kolkata nowadays, and then along the coast, it spread to Myanmar and Sri Lanka. Furthermore, during that period, it also spread into the Middle East from Turkey, Syria, and even into Iraq, like Basra in Iraq. This rapid spread was evident as the first pandemic. Pandemic means an epidemic which spreads all over the world. This was the first pandemic of cholera that the world experienced. At that point of time, Europe was spared, but a few years later, the first case was seen in St. Petersburg in Russia. Thereafter, like the Indian subcontinent, the disease spread rapidly throughout the Europe, and along the trade routes, it even spread into the Americas, Mexico, and Cuba. Thereby, the whole world affected by that point of time. Later on, we would see 7 pandemics till today. There are many historical differences as when the timing of the pandemics, but overall we can say from 1800 to till today there have been 7 episodes of pandemic. Currently, we are in the 7th pandemic era. Now, during the pandemic which hit the Europe, various measures were being taken up. Many people were dying, and the disease was more commonly affected with the poverty stricken areas. One gentleman called Edwin Chadwick, one of the pioneers of the melasma theory, he theorized that the disease was spreading because of the foul air that is present along with the sewage and garbage. Although his theory was correct, but what the steps he took a drastic turn. He ordered in London, he ordered all the sewage to be collected and discarded in the river Thames, which was the drinking water source, furthermore fueling the pandemic. By that time, another gentleman called as John Snow, he studied the epidemiological the cases in London and mapped the cases on the map of London. And he theorized that the source was the drinking water. And hence, the common sources were closed for public drinking, thereby leading to reduction of the cases. Hence, he is also called as the father of epidemiology. Later on, the Italian anatomist Filippo Passini and furthermore by Robert Koch, their contributions ultimately led to the discovery of the causative agent of the disease, which has plagued through many years. And this disease was a gram negative bacteria, gram negative bacilli, which was curved in shape, if you can appreciate, and on fecal sample, they were motile, vigorously motile. This motility is also called as darting motility, moving like darts. Hence, this organism was called as Vibrio cholerae. Now, like any other gram-negative bacteria, this bacteria also has a outer lipopolysaccharide, outer membrane protein. Further studies when conducted led to the discovery of various groups. Those groups were divided based on the O polysaccharide that was present in the lipopolysaccharide. And this was divided based on the types from O1 to O140. Among them, only O1 and O139 was attributed to the disease, albeit production of a particular toxin named as the cholera toxin. Coming to the serotypes, O1 was further divided into three types of serotypes called as Inaba, Hikojima, and Ogawa. Furthermore, there is also called as biotypes. Biotypes means it's the same organism, same serology, but different in some of the metabolic or morphological parameters. This was described as classical and the alternative one called as L-Tor. Why L-Tor? Because it was named by the first time in a city in Egypt called as El-Tor, where the disease was found in the people who were going for the pilgrimage. Now, what are the characteristics of Vibrio? Now, all the organisms which belong to the Vibrio group, they can be divided into two types, halophilic and non-halophilic. Halo means salt and philic means loving. So, some group of the Vibrio were more growing, or rather they can survive in salty conditions. They were called as halophilic. The others could not. They were called as a non-halophilic Vibrio. Now, when we say it's halophilic or non-halophilic, that means increased salt concentration. So, the natural habitat of this organism is salt water, that is the seas. They are commonly associated with the crustaceans that are found in the sea. Gardner and Venkatraman classified Vibrio in this. The first is the Vibrio, which are classified into Vibrio cholerae and other Vibrios. Vibrio cholerae is again subdivided into groups O1, O139, and all other Vibrio are classified as non-O1, O139. Now again O1 is classified into two types, classical or Oltor, and coming to the serotypes, they are divided into Ogawa, Inawa and Hikojima. Now an important difference is the differences between the two biotypes, the Eltor and Vibrio. Eltor and the classical type of Vibrio cholerae. If you look at this this picture, you can see there are various differences ranging from whether hemolysis is seen on sheep blood agar or not, susceptibility to polymyxin or fudge. But a very important difference, you can see the last line is the type of the cholera toxin that is produced. In the classical type, it is the cholera toxin 1, and the L-TOR, it is slightly different, hence called as the cholera toxin type 2. I have already told you we are currently in the 7th pandemic. The earlier 6 pandemics were caused by the classical type, but the 7th one is caused by the L-TOR type. Another very interesting part is what is the outcome of the disease. Earlier, when there was no treatment available, the mortality rate could exceed up to 60% of the cases. But in today's time, with proper therapy, the mortality rate is less than 1%. Hence, now you can understand how effective treatment can decrease the mortality and morbidity of the disease as of today. Now, let us try to understand a little bit about cholera toxin. The cholera toxin has got two parts. It is called as the subunit A and B. The A subunit is the main enzymatic, has the main enzymatic activity, whereas the B subunit, it binds with the intestinal cells. Now, if you look at the pathogenesis, first you have to understand what is the infective dose. Infective dose means the number of the bacterium that a person must ingest for the disease to occur. Well, cholera bacilli has a very high infective dose. That means the common route of infection is ingestion of contaminated food and water. That means the bacteria must be present in the food or water in a very high concentration to cause the disease. Once this bacterium gains access into the intestine, it starts producing the toxin. The B subunit of the toxin will bind with the intestinal cells, and the A subunit will be uptaken into the cell. Once it is uptaken, it will interfere with the normal adenine cyclase activity and the protein kinase, leading to release of chloride sodium ions. Release of these electrolytes will lead to subsequent release of water from the cells into the lumen, thereby releasing copious amounts of water and electrolytes. Now, what will happen? There will be huge loss of water from the intestinal wall. I think you have already read in the physiology, the biggest percentage of the water absorption occurs in the intestines. Furthermore, because of the release of the ions from the body will lead to dehydration of electrolytes. I think in physiology you have already read the dehydration occurs in two types. One is the water dehydration and is the salt dehydration. So, in this case scenario, both salts and water are lost, thereby causing severe dehydration, which may ultimately lead to dehydrative shock, renal failure, and death. Coming to the clinical manifestations, most of the patients will be asymptomatic. Only a small fragment of the patient will be symptomatic. And among them, only 5% will have severe disease. And the severe disease is manifested by watery diarrhea, also called as the rice water stool. Vomiting may be present, fever is generally absent. Now, because of this watery diarrhea, the patient will be dehydrated. The patient has to be classified based on the kind of dehydration. The manifestations will be based on how much the fluid loss is there. Generally, up to 5% only the patient will complain of increased thirst with no other physical signs and symptoms. As the patient becomes more and more dehydrated, we can find other signs like postural hypertension, decreased skin color, tachycardia, and when severe dehydration occurs, we can find oliguria, sunken eyes, wrinkled skin, and these are more prominent especially in children. Now, what is the current scenario? In the current scenario, we can see that first of all, the government of India has made cholera a notifiable disease. The reason is very simple. This disease has a high propensity to cause outbreaks and epidemics. Hence, any case or any patient who is suspected of having cholera should be notified to the public authorities. The next is most of the cases as of today are caused by the L type. Earlier, the Indian subcontinent, especially the Gangetic Delta in the Bengal, in West Bengal and Bangladesh, were considered as the home of the cholera. But as of today, West Bengal is no longer considered. You can find the National Institute of Cholera and Enteric Disease in Kolkata, an institute dedicated for the disease. Reservoirs, human beings are the only reservoir, and the carriers are the causes whose source from which most of the cases will occur. It is classically seen in what is called as the cholera season, that means in the monsoons. Because of the heavy rainfall, there is flooding. Along with the flooding, other conditions also predispose like poverty, malnutrition, food scarcity, and non-access to drinkable water are the very important causes. Furthermore, there are many other regional political causes like refugee problem, poor habitation. These further amplify the cases. There are many other factors, like many findings have been shown that blood group people with the blood group O are at a greater risk, whereas AB are at a less risk. But more importantly, what you must understand, during the epidemics, the cases and subclinical cases are the main reason why the disease spreads. However, in the inter-epidemic period, that is when epidemics are not seen, the same bacteria are found in the sea water, and they are maintained in the natural habitat on the crustaceans in a particular form, which are also called as viable but non-culturable. That means they do not spread but remain in a state in which they are surviving, that is, they are viable, but they do not spread. Various other geological factors also played a very important role in spreading the epidemic, like the El Nino and the El Nina phenomenon that occurs in the Pacific and the Atlantic waterbeds, which determines the flow of the water currents from one ocean to the other. And that also determines how the disease will spread from one continent to the other. The other important factors that you must understand, this bacterium is acid labile. Hence, people with achlorhydria or people on antacid therapy have a higher propensity to get infected. Similarly, this organism is heat labile but is able to survive on refrigeration. This is also very important, especially if there is an outbreak. The people should be advised to consume only food that are freshly cooked and heated. Do not to consume refrigerated food, and if there is no proper method of purification of water, the best method would be boiling. Finally, these bacterium are easily killed by drying, sunshine and disinfectants. Why this is important? Because if you do encounter a patient suspected of having cholera, you must take adequate step to disinfect whatever the fecal matter or the vomiters that the patient is uh, giving out with the help of the disinfectants, because that would be the source of the spread of the disease furthermore. Now let us look how we can diagnose this case. In clinical cases, the best method would be to take the stool sample, and in case of carriers where the person is not passing stool, we can take rectal swab. It is transported in various carrier transport mediums like Venkatragam wear medium or clariwear medium, and on microscopy we can find curved gram-negative bacilli with darting motility. Furthermore, on culture we can use selective media like TCBS or even McConkey agar, and various biochemical tests like catalase, oxidase, indole, citrate, and other automated methods like Vitek and Multitop can diagnose the organism very easily. Rapid test can also be used to diagnose on the field. In this picture you can see the growth of the bacterium on blood agar showing hemolysis, and on TCBS agar you can see yellow colored colonies. Another important test that can be done for identification is string test. That is, if a colony of bacteria is taken and emulsified in a drop of normal saline and the loop is pulled up, we can find formation of string. This is positive in case of Vibrio cholerae. After the organism is identified, a very important step is to identify the biotypes and the serotypes. The reason is of mainly epidemiological study, because we need to identify whether it's a classical type or the L-dot type. Antimicrobial susceptibility testing is very important, however, we will come to that later. Now, before coming to the therapy, an important historical event should be mentioned over here. In the year 1971, during the formation of the Bangladesh, there was huge immigration of people from Bangladesh to India. At that point of time, during the refugee crisis, there was an outbreak of cholera. Many people died, and at that point of time, a Bengali pediatrician, Dr. Dilip Mahanavis, he devised a very effective form of therapy, trying to rehydrate the patients with sugar, salt, and water. Later on, this therapy was further modified to form what we know today as the oral rehydration therapy or the ORS therapy. Now, why this is important? Because the most important cause of mortality in patients suffering from cholera is dehydration. So, the most important therapy is fluid replacement. How to do that? If the patient is able to drink, the best method would be oral rehydration therapy. And if the patient is too incapacitated to drink, then intravenous fluid therapy should be continued till the patient improves, later on replaced by oral rehydration therapy. Antibiotics can be given, but please remember the disease is toxin mediated. If the antibiotics is given right in the early phase of the disease, it will be very effective, but later on it will not so be effective. However, antibiotics is generally reserved according to WHO only in severe cases, so that the severity of the disease comes down. Commonly antibiotics used are azithromycin and erythromycin, alternatively doxycycline, tetracyclines can be used. This was the treatment of a patient. However, some preventive measures should be taken up so that the disease does not spread into the community. What are these preventive measures? Is ensuring people have safe food, water, and safe sanitary disposal. If that is not affected, then the disease can spread rapidly from one person to the other. Next important is the chemoprophylaxis, which can be given to the people or the household contacts of the patient. However, this is recommended only during case of epidemics, not otherwise else. Now, coming to the vaccines, we do have vaccines for cholera. We have the oral vaccines, the killed and the live vaccines. Among the killed vaccines, there are two types of vaccine. One is the whole cell vaccine. It basically contains killed whole cells of O1 and O139. They are given, two doses are given orally at a minimum 2 weeks gap, and it gives a protection for about 3 years. Another type of the whole cell vaccine is the whole cell vaccine, which contains the recombinant B subunit of the cholera toxin. Okay, that is the whole cell plus the B subunit of the cholera toxin. This is given in 2 doses with a minimum 1 week gap, and it gives a protection for up to 2 years. For live vaccines, we do have live vaccine CVDH 103 HGR. This vaccine gives about 90% protection to people 10 days after vaccination, and it lasts for about 3 to 6 months. Now, this vaccination is recommended especially in case of people going to pilgrimage like Hajj or Kumbh, etc. Now, this was all about the type of the Vibrio cholerae of O1 and O139. What about the other? I have already told you there are about 200 subtypes. The others are called as the known O1, O139 Vibrio cholerae. Why? Because they do not aggregate with O1 or O139 antisera. Now, they commonly will cause gastroenteritis, commonly acquired by eating seafood, especially raw or uncooked seafoods. They may cause gastroenteritis, abdominal cramp, and rarely they will cause systemic infections. Now, among the halophilic vibrios, we have Vibrio parahemolyticus. This is another type of Vibrio. These infections are generally they will cause foodborne gastroenteritis. I have already told uncooked seafoods. However, they can also cause severe infections, especially otitis media and sepsis, if they gain access. People may end up swimming in the seawater with an open wound, and they can acquire these kind of infections. Gastroenteritis is caused by parahemolytic is generally self-limiting. However, systemic is very severe, hence antibiotic therapy should be given. A similar type of illness is also seen with Vibrio vulnificus. This organism will very commonly cause sepsis, especially after wound infections. These are commonly seen in people who are in the occupation of catching seas in the oceans or handling fishes. Another type is Vibrio alginolyticus. They also cause wound, ear and eye infections, and they can survive higher concentration of salt directly from seawater. So that was all about Vibrios. There is another bacteria which was earlier placed in the Vibrio. Later on, it was separated into Aeromonas. This bacteria is called as Aeromonas. It was originally identified to cause red leg disease in the frog. Like Vibrio, it is also a gram-negative bacilli and it's curved in shape. In human beings, they can cause severe infections, both producing endotoxin and various virulence factors, and cause severe infections from gastroenteritis, peritonitis to wound infections, sepsis and respiratory infections. Okay. Although now it is no longer part of the Vibrio family, but Aeromonas can also cause severe infections. Like Vibrio, we can identify by culturing and with the help of automated system like Vitek and Multitop. This bacterium is also seen to be producing beta lactamase. Right now, we will not understand the importance of beta lactamase, but this is one of the main enzymes which results in antibiotic resistance. Hence, infections with this organism lead to infections are very difficult to treat because they can be resistant to multiple groups of antibiotics. So that was all about this group of organisms called Vibrio and Aeromonas. Okay.